Chris, again, that just continues to confirm, how I started this conversation about how amazing you are. And again, you're not that person to ever stand before anybody to tell people how, all that you've accomplished. But, I think that's a big part of it. When I hear that when I listen to the video about you taking the vaccine, just testing it out for us. You know what I'm saying? You didn't do it for Dr. Chris. You did it for us as people of color. I can only applaud you for your courage and your love for your people, and that's dope.
And I know this is a personal.
Chris, hold on one more second.
Okay.
I got a principal who has to go inside and get her son in a minute, but she wanted to say something before she left. Marissa, Principal Forrester.
Hi. Good afternoon, everyone. Hi, Dr. Pernell.
Hi, how are you?
Good, I'm doing well. I'm Marissa Forrester. Do you have any advice in terms of for students who are going to want to take mask breaks? And we know that it's going to be very difficult for them to keep their mask on for 6 hours out of the day. What is your advice around them doing that in the most, secure way?
Okay. So we struggle with this at the hospital, right? So, I live in a mask at the hospital. The only time my mask is off is when I'm in the confines of my office and no one else is around me. And I have gone back and forth with our workers who either they have breathing issues or it's just anxiety provoking. So I definitely can identify with that. And kids are just kids. Kids are going to take their mask off. The thing about kids, and I think is very important to emphasize is, one, we have to somehow make the behavior of wearing a mask, we got to be creative around it. I struggle with my youngest niece. Whenever we have a church service once a week and we have assigned seats and we stay 6 feet apart, and she's always like, I want to take my mask off. And I look around, Kai might have her mask off. So she's a kid with a lot of energy. It's going to happen. I'm not going to sit here and tell you that kids aren't going to take their mask off. The only time it is safe to be in an environment with a mask down, let's say if you had a child who was going to the bathroom and there was no one else in the bathroom with them. Sometimes I've had about a couple of weeks ago, I was at the hospital on a Sunday and I had a woman who was literally having an anxiety attack. She was in the ED, her grandson was sick, and she was like, I just can't do this. And so I said, look, come on, let's walk, let's go outside. Because I knew she just needed, a change of scenery. She needed to be able to be free so she could go outside and she could take her mask off. Other than that, there's no way around it. You got to keep the mask on.
Dr.
You have to
Chris Pernell, thank you. We have another question from Toya from Carter's Daycare.
Yes, I don't know if it's a question, but after Dr. Pernell, thank you for joining us. And Dr. Action, when you were telling your story, my mom went through it. So if I tear up, it's just because I'm about to go back into that past. She's 78, and when Dr. Action said the hallucinations, the numbness in her feet, prior to having COVID, she already had pre-existing health issues. She got diagnosed with diabetes. So when she started feeling that numbness in her feet and in her arms, we thought it was diabetes. I guess I'm just so frustrated to where we go to the doctors and they just can't tell us anything. Like, it's like, what is she supposed to do? She's 78. She's at the point where she can't take it anymore. Like, her body physically cannot take it anymore. And so I was with her going through the whole phase. So it's like I didn't physically go through it, but seeing her go through it and being helpless, not being able to help her, I actually thought that we made it out of the stove because we made it past COVID, and she didn't have to go to the emergency room because the breathing was the only thing she wasn't affected by. But now I feel like, Jesus, is this gonna ever end? So I don't know. I guess I'm asking. I know you took the vaccination, but is there anything that she can do? She has to now see a psychiatrist because they're the ones who have to. Well, they said they're the ones who have to give her medicine so that she can get through her night. She's not sleeping. She still feels the tingles. She still feels the numbness. Mm-hmm. Just throughout her, she explains it like it's like a sickness in her body. Right. She can't really pinpoint how it feels, but she's just like, she don't feel, she's not eating. And it's just like, she goes to the ER, all her vitals are well. So they're like, we can't do anything for you. So they send her home, but she's home and in agony. She's crying every day and sleepless nights. And it's just like, what can they do? And I just feel like, so I live in Harlem. Mount Sinai used to be the good hospital. Now I feel like it's going down, like how Metropolitan was. Those are like the nearest hospitals in my neighborhood. And I just don't know. I don't know.
You know, I can identify with you and with Dr. Action. So, you know, my sister, for the longest time, and she would describe it almost exactly like you did, Dr. Action. She would say, I could feel my heart beating, and I could feel, she's like, I can feel it in my chest. And she was like, when I breathe, I can feel my lungs in my body. And I know it was frightening for her. Look, my sister went through breast cancer. She went through chemotherapy, she went through radiation, and she went through surgery. So she is a tough woman, right? She's endured medical hell. And so she was like, I just can't describe it, right? And it's just like, I feel like I'm not getting a full breath. There is unfortunately so much we do not know about coronavirus and how it's impacting people. Like, for instance, we call them long haulers, right? So so my sister first got infected in late April, but we're in September, right? And so she still have residual effects, not being able to breathe well, the changes in cognition and the changes in your nervous system. We are finding that is because of a coagulopathy. So like the blood clots more. So that's why you have that sensation of the numbness and the tingling. I can tell you what we're doing at University Hospital. We have a clinic that's just dedicated to people who have survived COVID, right? So we're putting our best minds together to think through what are the type of services these people need. And basically it's a trauma recovery model. You've been through trauma, right? And so whether that is cognitive behavioral therapy, whether that is a psychiatrist, whether that is a pulmonologist, in addition, you've been through a trauma, right? And so we're really looking at how do you help people heal from a trauma. And it's not just physical, it's mental and it's emotional. Because I even see it in my workers, right? I see it in my workers who have like a form of PTSD because of what they've witnessed. We've had our fellow co-laborers in the hospital who died, some of them who we treated ourselves. So unfortunately, I would say that, you know, your mom, I don't know, I'll look it up for you and I can let Dennis know. Your mom should be a part of a center where people are just focused on those who have had coronavirus and are having a long time to recover, right? Because it's something that we need a multidisciplinary team around the table to think through. And sometimes I think doctors are overwhelmed because they don't know what to do.
I just want to say thank you so much for that. That analogy, I was just thinking this morning because I recently saw just snippets of the various articles that are coming out from the OSG leaders. And, you know, I was thinking about my article, right, as I begin to get ready to formulate that. And I've always, you know, envisioned myself where the analogy that I use is that I'm frontline infantry. You know, here I am as the principal, and I'm in my office right now. I'm in the building every day as a model for my staff. And I would be remiss to say that there are nights when I am alone and, you know, and afraid. You know, and so, you know, we are a district where we have signage and kits for every single teacher when they come back in. The goal is cycle 2. We will then be a hybrid model with only having 10 students in each homeroom based on CDC guidelines and to ensure that we do have 6 feet of social distancing, right, and things of that nature. But it is the fabric and the epitome of who I am, Sakina, as a leader, that, you know, I run into the burning buildings too, you know, and I'm always on the front lines. And so, you know, it made me think about, you know, principals also being on the front lines with healthcare workers, because we were here being exposed and giving out Chromebooks everything that we had to do to ensure that students in our school-wide communities had what they needed to be successful. So, I thank you for that. And I thank you for that analogy. I don't know if I'm still in this moment a brave heart in terms of wanting to test out a vaccine. I have to be really honest. But I'm definitely here in this building every day. And, I've opted not to be a remote school principal. And I respect everybody's, personal decision or reasons, if they are a remote principal and, what their reasons are, but I'm here. The last question that I had is.
Let me just jump in real quick. So, Ken, let me just jump in real quick and just say something that I heard Dr. Pernell mention earlier, and I mentioned it earlier as myself, is that sometimes we can get lazy in our precautionary, our practices to keep ourselves safe. Nobody here judges anybody for going back in the building, but I'm telling you, just like everybody else, when they get tired, we get lazy. Just if you're in these buildings, make sure you stay masked up. Make sure you start doing, taking all the precautions, wash your hands, everything else. Because again, it's going to happen. I mean, most of the mistakes we make is when we're tired and fatigued and you're running around the building, dealing with a lot of emotions and things like that. And so it's going to be a natural instinct. And then what we'll end up saying is, okay, well, this room isn't that bad. It's a little safer than the other one, so I can take my mask off. Or we go here and we'll go in the bathroom and we say, well, you know what, we can go there, but maybe it won't bother us so much. But I think it's important that we remember, for those of us, I don't care if it's walking into a school or walking into a Walmart or walking into a restaurant, we all at times get a tad bit lazy and neglect to take responsibility for keeping ourselves, our families, and for people around us safe. Okay, so I just wanted to just jump back in there and say that, because I don't want that to be overlooked by anybody in here. That what Dr. Pernell is basically saying is mask up and stay masked up as long as you can.
Let me ask you a question. That number, 200,000 people dead from the corona. There's a lot of right-wing talking points that are saying that that number is not a real number. How real is that number, 200,000?
I think that number is the floor. I can't say it more direct than that. And I'll take you back to that stat that we encountered in New Jersey. Between mid-March to the end of April, we had a 200% increase in dead on arrivals when our EMS went out to a sick call.
Wow.
And we had no way of confirming. We didn't do post-mortem studies. So we had no way of confirming if all of those people had coronavirus. We just went by known symptoms that family either reported, or we tried to patch together information. I know people had coronavirus and did not know they had it. Testing was not adequate, especially in the beginning, right? And so there have been at least 200,000 deaths, at least. And they're in the sense that if I'm young, I'm safe. True, in older populations, the risk is higher. But for Blacks, the risk is compounded at every age because of the risk factors we bear because of racism. We're just in situations and scenarios that are riskier, crowded, more dense, substandard housing, not having jobs where we cannot work the front line. And we bear disproportionate risk. That's another reason why I did this, because we are exposed more often. I used to tell my sister all the time, don't go to work. She used to tell me how Walmart was not giving them adequate protections. And I was like, don't go. You have survived cancer. Don't go, don't go. But she felt the need. She's like, this is my job. I'm the manager, blah, blah, blah. I have to go. And she got exposed to coronavirus, right? And so that number is the floor.
Jeez. Well, and then my other question, I'm a world traveler, and I'm finding out now, because most of my travel is overseas, and I'm seeing that there's a big upticks in Europe, all of England and Spain, France. Now, here's the question. We don't really know the end result of this virus yet. Now, when they had the measles virus, that took a few years to get right. My question to you is, how can we be sure if we take this virus that it's going to be this vaccine that it's going to be right? And I salute you for taking this and risking yourself to take this virus, sister. I mean, you don't even understand how much honor I have for you and Bishop Pernell. But let me just say to you, man, how can we be sure that this vaccine is going to be any help for us if we're not even sure what tadpole this virus is going to land?
Okay, so let me answer that in parts. So there are several safeguards throughout the process. Another one was announced today, right? Some of these safeguards are built into the process by the NIH, there's a data and safety monitoring board. Then there's the study protocol team. They look for reactions in real time. The data and safety monitoring board looks across every 6 months just to make sure. So I'm going to be followed for 2 years. The vaccine, it may not be the trial I'm in, but a vaccine will ultimately be made available to the public. It will not be made to the general public, available to the general public first, because production of doses, right? So we will follow these people through the years, and we'll be able to say, is there a delayed response? And this is how we perfected our polio vaccine. This is how we perfected a lot of the vaccines that have eliminated and eradicated measles. So those are the safeguards built in. Today, the National Medical Association, which is the association for Black and African American doctors, have come out and say that they are going to review the data because our community has been disproportionately impacted. They themselves, Black scientists, Black physicians, they are going to review the data, right? We're having full awareness of everything that we have of experience to ensure that this is safe. The president and the lack of integrity around this process at the federal government has complicated this. Saying things like the vaccine should be available before Election Day, that's unnecessary, and that's creating greater confusion. No, the vaccine should not be available by Election Day. Moderna has come out as the trial that I'm in and said that they might have some information by November in December, but that all depends on how many cases are in community, because we have to be exposed to it to see, do you get it or do you not get it? That's how the vaccine is proven effective. That's not on the safety side, but the effective component. So this information will play out across time.
But thank you again. Be safe out there. We love you. We love you. We love you. We love you. And please, again, come back on. Like I think you made a world of difference to us today. Thank you so much.
Okay, y'all very blessed. Bye-bye.
All right, take care.